Hello, everyone. Good afternoon. Good afternoon. This is Dr. Velma Scanterbury coming to you live from the from the Dialysis Patient Educational Center. And we are here live. I want to welcome everyone and thank you for joining. This is Dr. Scanterbury Ask the Doctor Question Day. So we are here and it's a new month. It is December and we are 21 days away from the Christmas holiday. We just had Thanksgiving. I know many of you have gathered with your families, friends. Some of you may not have gathered, but that's okay if you choose to be alone. But hopefully, as we go into this new holiday month, that you are finding some joy and happiness as we come to the end of the year and as we are thankful for being alive another day. And oftentimes we see the negativity and the downside, but every day that we wake up is another day and another purpose for our own lives, and perhaps even another chance to be of help to someone. So certainly, or maybe somebody can be of help to you. Oftentimes, we want to make sure as we gather, and I think many of you have come together for Thanksgiving or other holidays that just passed, and we want to make sure as we pass that love and that joy that we're not passing around our illnesses or the things that are that we should have protected ourselves against. And sometimes you can't often make other people get vaccinated to protect you, but our goal is really about talking about how we can protect ourselves by being vaccinated. We don't know who are anti-vaxxers and we don't know who don't feel like they need to, but you know, as either a transplant patient or someone on dialysis, or even if you're just a caretaker, that it is important for you to not only protect yourself, but be able to protect others who may also be at risk. For instance, if you're a parent and you have someone who is immunocompromised, and even being on dialysis in an immunocompromised state, get your vaccinated. Make sure you get your flu vaccine. And those of you who are 65 and over, we have the over 65 vaccine, flu vaccine, which allows for double the amount of vaccination that's given, because as you get older, our immune systems don't work as well. And so you are more at risk. We don't make as much antibodies. Our cells are not as efficient. So we give a higher dose of the vaccine to those over 65. Certainly for RSV, the age has changed to 75, but certainly if you're immunocompromised, that's another area, whether you have diabetes, whether you're on dialysis, whether you have heart failure, things where your system is not working as well, it's important to also get that vaccine, get the COVID vaccine. People say, well, you know what, I've had 3 vaccines already, I have 5, I've had enough. And now what I say is that just like the flu, from year to year, the viruses and the strains of the virus change. So it's different. The flu vaccine you got in 2020 certainly is not going to work in 2024. And the same thing with COVID is that it mutates and it changes. And so the booster you got in 2022 and 2023, those antibodies have already waned and they are no longer effective because the virus has mutated and now it's changed. And so in terms of those antibodies may not be able to recognize the new strain of COVID that is coming, that is now around. And the same thing with the flu. Just because you had the flu shot in 2023, in 2024, it's a different strain. It's a combination of a whole lot of different strains. And so they find out what's common currently, and the vaccine is made against those that are current. So I encourage you to go ahead and protect yourself. protect others as you and protect your loved ones, because as you gather for any holiday season or family get together, certainly there are going to be not only there's going to be a lot of hugging and kissing, but there's also going to be some spitballs passing around, being thrown out in the air, and so you want to make sure you are protected. Wear your mask if you feel that you're overly immunocompromised and it keeps you from inhaling all those things. Make sure you wash your hands. We've gotten a little complacent when it comes to going into bathrooms that other people are using, so we make sure that you use that paper towel to grab the knob to open the door, and make sure you carry some hand sanitizer so you can continue to do those important things as we come together over the holidays. People are still being admitted. People are still being in the ICU from COVID, and there's not as many deaths, but there's still hospital admissions. If you're immunocompromised and you do get COVID, remember there is medication out there if you take it within the first 3 days. So test yourself, and if you are immunocompromised, call your doctor so that they can call in some medication for you to the pharmacy. And what that does is it speeds up your infectious period, lessen it to some degree, and allow you to get better in a shorter number of days by helping fight that virus low. So definitely contact your health provider so that you or your loved one can get treated so that you don't develop pneumonia or consequent issues from COVID, which still can cause blood clots and other detrimental things. So especially if you have a history of asthma or COPD or other respiratory disorders, the biggest issue is that it make your respiratory system worse, which then compromises your ability to breathe, leads to more fluid retention, and also pneumonia. So that's important. Thank you so much for bringing up that question, and appreciate you all for being here. Again, I'm Dr. Scanterbury. This is your live session at Instagram, Ask the Doctor session, and we are here at DPC Educational Center to answer your questions. So thank you for joining, for those of you who are coming on. So as we know, certainly if there's a topic you would like to talk about, one of the things you realize is that you've come together for this past holiday, giving thanks, but also as you approach holidays, especially for those on your dialysis. I see so many patients who are afraid of having conversations with their family, or afraid of asking or educating them about need for kidney transplant. Although, okay, I don't want to ask my family, but the more you talk about how you arrived to your course of needing dialysis or your kidney failure and your requirements that now that you are on dialysis, the more people understand that kidney disease is a silent disease. It doesn't come with warnings that say, hey, your kidneys are failing. You continue to make urine. You may feel a little fatigue, and many of us don't understand that level of fatigue. It's like, okay, maybe I overworked. Maybe I stayed on my feet too long. That's why it's swollen. So get yourself checked, and tell your loved ones about how you arrived at your decision to be on dialysis or getting a transplant, and educate them on the need to spread that word around. Another question, is there any information about kidney rejection after someone gets COVID? So the issue with any viral infection is, and the nice thing is that now we have medication, but before we haven't had medication to treat COVID, the goal was to support the patient. And oftentimes what the transplant doctors would do was be to lower their immunosuppression so that the body's immune system can be strengthened so they can fight off that virus infection. So generally we say, well, your body is compromised and you're not able to make those antibodies, and your surveillance is protecting your kidney. It allows the viruses to multiply. So to allow the viruses to be attacked, we lower the immunosuppression So sometimes it's important to recognize when you're getting better, because as you lower immunosuppression, you allow your body to take care of that virus infection, but it also allows your body and your white cells to now say, I didn't recognize this kidney there. So now you may be at risk for rejection as your medications are lowered. So but fortunately, while you treat now that we have Paxlovid and other medication to treat the virus, you may not need to lower your medications, your anti-rejection medicines as much. And so there is a risk of rejection depending on how ill you are and how much your medicine has been altered. That then allows your body to say, okay, now you unmask your kidney, and suddenly you may have your creatinine may go up. But it's also important to recognize that oftentimes for patients, depending on how compromised they are with the infection, that it may be also dual things going on. So making sure you're not dehydrated when you are sick, making sure you take your fluids in, keep your temperature down, and remember to, oftentimes afterwards, you may want to get labs within a few weeks afterwards to make sure that your kidney function has not compromised. So treating an infection can often lead to rejection because you're altering the immunosuppression to try to allow your body to really get rid of that infection by boosting your immune system. But in boosting it, now you also allow for recognition. Great question. Thank you so much. So certainly one of the things that I often tell patients as you go further out from your transplant, they're often advised to increase the interval between getting lab work because they're doing so well. So some patients may not be getting lab work every other month. They may be getting every 3 months or every 4 months. But remember, if you get sick and your immune system is then called upon to change, either to fight an infection or there's something going on with your system, you need to make sure that you follow up with labs, because that alteration in your immune system can change your defense mechanisms, and oftentimes can spark a chronic rejection that may be subtle and may be ongoing, but doesn't really change. You cannot see it in your normal day-to-day symptoms. You're urinating the same, but suddenly 3 months later, you're finding that your creatinine is now significantly higher than it was before, because that slow attack that was sparked by whatever infection you had is now still hanging around and causing a little rift in your attack on your kidney. So it is important, if you have a long interval of getting labs, if you're ill, to shorten that interval and request to follow up with some new lab work. So that is one thing to keep in mind. So again, thank you so much. I'm Dr. Scanterbury. I'm here as a doctor Wednesday, December 4th, first Wednesday in the month. And this is the last month of 2024, and we'll be moving into 2025 after the end of this month, and when we come over 25 days. So thank you so much for joining. If you have any questions, please post them in the chat. Remember that it's important to stay safe. For those of you who just joined, making sure that you continue with getting your vaccination, talking to your doctor. If you're traveling and in public bathrooms, make sure that you're using your hand sanitizer and not touching knobs, because many people are traveling these days. And if you are at risk or immunocompromised, you're more in danger of getting infected. So get vaccinated. And we know that even though you are immunocompromised and you get vaccinated, we know that the amount of antibodies that you form may not be as the same as someone who is not on dialysis or not have a transplant, but it's certainly more than you would have if you didn't get vaccinated. So it is important to say, even though I'm immunocompromised, I'm still going to do this, even if it's 50% of the antibodies I would normally make if I wasn't on dialysis or if I wasn't on this immunosuppression. So please, not just yourself, but encourage your family members and those who are going to be around you to also get vaccinated. So I appreciate you guys being here. It's 12:45. Let me know what else you would like me to talk about. I've seen several patients this month with heart failure and kidney disease, and you have to, and it's not a great combination, but if you're on dialysis, especially if you have been on dialysis for many years, especially hemodialysis, you're always at risk for worsening heart disease. So managing your fluid is certainly important, and making sure that if you have underlying diabetes or high blood pressure for many years, more than 20, 25 years, that your doctor is certainly following you, or if you're not seeing a cardiologist, to monitor your heart function. See where it's at, what is your ejection fraction. If you haven't gotten an echocardiogram in 3 to 4 years, it may be time to get one, depending on how old you are or how young you are and how your heart's doing. And if you're not making any urine and you find that you're retaining, or you have decreasing ability to lay flat and you're struggling to breathe, you accumulating more fluid, that is also a time that you may want to think about seeing a cardiologist to assess how your heart's doing. Another question in the chat: what do you recommend to patients who are afraid of dialysis or transplant? Is mental therapy an option? Certainly, I think patients who don't want to be treated, or if they're afraid of what they will deal with or what it means, it's really about oftentimes not understanding the process and understand that this is your life link. If you are 90 years old and have decided that you do not want to be on dialysis, or you had a great life and you're just going to live the rest of your life without being on dialysis and can't get a transplant, then that's your option. If you're younger, then I say, let's talk this through. Let's see what your options are. Let's see if you understand what this decision means in terms of saying, I don't want to live anymore. There's some patients who do that and may live for a few months or a few years, depending on how bad their function is or how good their function is, in opting not to be on dialysis. They may not be a candidate for transplant. I can't see anyone not wanting a transplant, knowing that it will restore your quality of life. Maybe they're afraid of surgery, but understand you're put to sleep. So certainly seeing a therapist, having a discussion with a psychiatrist to figure out what's your underlying fear, what's your barrier. Maybe you saw people in your own family or others who did poorly on dialysis, or who may have passed on dialysis, but everybody's story is different. So there's no way of knowing what their course was, so yours may not be the same. So it's really about getting the facts, understanding and laying out before you, so you have a clear understanding. And if you still want to make that decision, whatever your decision is, as long as it's a knowledgeable decision and you understand what you're venturing into, that's fine. Some people feel it's not for them, but that was their decision. I've always remembered a young lady who was a nurse when I was in Pittsburgh, and she had a recurrent disease, and this was in the age that Prograf was just available, and she had a severe proteinuria and had 3 transplants under 3 options of different immunosuppression, and nothing was able to cause her kidney to survive. Her proteinuria came back dramatically, and she did not want to live on dialysis without the hope of transplantation. And that was pretty devastating, but she was an educated nurse, and she opted to say, this is not how I want to live my life. And so she came off of dialysis. She lived for a few months, but she eventually passed. But that was her educated decision, that there was no hope for transplant for her, and life on dialysis was not something she wanted to make. But after significant therapy and understanding that she was okay with that decision, that was acceptable to her and her family. Some people didn't agree with it, but that was her decision. So an educated decision is certainly worth making sure that that's in place when people are opting not to do these things. A lot of it, as I see patients come to transplant after many years of dialysis, they were afraid of coming forward to transplant. They didn't really understand the process. They saw others did poorly, and therefore they felt that would likely be their outcome. So it's always important to make sure they get the best information possible and that they get the real facts as opposed to what others have told them. So great question. Thank you so much. Dr. Scanterbury here. We have less than about 10 minutes. So if you have your questions, certainly it's important. Go ahead and ask them. No question is a bad question. If I can't answer, I'll certainly try to get you some answers at another time or direct you to the right place. If you haven't been on the website, DPC Educational Center website, please go on. There's tons of information. There's information on ways to help you eat better. There are recipes, nutrition. There are things about transplant. There are things about there are articles about how to control your phosphorus, which we talked about a few months back. Getting exercise and even mental health. We were discussing mental health, which is a significant component and of patients that we see who are depressed, understandably, because now they've just been diagnosed or they see their disease as a dead end, which it is not. But when someone is acutely diagnosed with end-stage renal disease with no understanding, it's very devastating. And so that may be cause them to go and have some mental issues because they're dealing with something that they knew very little about. And so it's acceptable, it's the norm, it's you're not crazy, you're just in a difficult situation and a crisis. So that's so important. And so as Yolanda said, she wished her father had given it a try many years ago. Was very challenging, but after one treatment, he opted out. And so people are, it's often their choice, but you want to make sure that they're educated about that choice. And for some folks, it may, especially if you're over 80 and there's no option for transplant, some people say, I don't want to live like this, and that they would rather die without understanding. But some patients will try it after. You have to remember that the first and second dialysis is often done in hospital because it's very difficult, because it's a new experience. You're taking fluid off the body and it's very challenging. So letting them understand that the first few treatments will be difficult, maybe something that, and not, is the rest of them will not be like that. And even patients who, because life with a transplant is so much better, I've seen patients who didn't do, who opted for a while to get a transplant, and when they did, the transplant didn't work out very well. They either didn't work or they failed early, but they had very short time being off of dialysis. And while we as surgeons are so disappointed with that, the patient says, you know what, those 6 months, even though it didn't work, or that year, I'm going to go back and try again, because there's nothing like having not being hooked to that dialysis machine. So it's important to realize that when we see something fail for the patient, they have a whole different perspective about what it means to be off dialysis and to have that freedom to pee. So many patients are so excited when they can make urine again after not making urine for 5 years. So it's also important to realize that not a transplant may not be for everyone. And there's many people who have lived on dialysis or live on dialysis for over 20, 30 years and are doing well and can do well. But the reason they do well is that they're very strict with their diet. The two things that will lead to long-term, you have to remember that the number one cause of death is heart disease for patients on dialysis. Number one cause of death for kidney transplant is heart disease. And a lot of that has to do with the pre-factors, your condition that you were in when you came to transplant. So while we try to minimizing the time on dialysis will help preserve your heart function, but also controlling your fluid and being diligent about your fluid intake would also preserve your heart function. Your heart has to deal with all that excess fluid that you gain between dialysis treatments. And this is hemodialysis in center. When you're home dialysis, you have many better options of controlling your fluid overload because you're being dialyzed on a daily basis, 5 or 6 days a week, or whether you're doing it 7. So every day you take in fluid, you take it off. There's not as much ups and downs as 2 days, 3 days, then dialysis, 2 days, dialysis, 2 days, dialysis. And so that 10 kilos that you gain in between dialysis treatments are going to make your heart go like a yo-yo. So then just imagine, when you think about kilos, it's actually, just imagine it in pounds. We can't visually think about what 10 kilos look like, but you can figure out what 22 pounds look like. Get 5 bag, that's like 5 liter bags of fluid, 4 liter bags of fluid. Well, no, it's 22 pounds. So just imagine all that fluid your heart has to take on. And then you put it on in 2 days or 3 days, and now you're taking it off in 3-4 hours. And that your system finds it very hard to adjust to. So there's one danger as we go through these holidays and you're eating and you're taking time off and you're doing things with your family. Remember the dangers of fluid overload. And how it can compromise your heart from year to year. So the first year after dialysis, your ejection fraction may be 70% or it may be 60%, and then second year, third year, maybe down to 50%, and by the 6th, 7th year, you're now at either 30 or 40%. And what that means is now your heart is losing its pumpability. And for every liter it's pumping, if it's 40%, 600 cc's of that liter is staying in your heart, and so it's not working as well. And that's what we are afraid of. And so sometimes you also want to make sure that your fistula, your access isn't dumping into your heart. If you have a very high flow access, just think of this waterfall going into your heart, going whoosh, whoosh, whoosh. And your heart you're delivering high volumes to your heart. So it's important to make sure that you don't have excess return to your heart from your fistulas. So as you end this year, make sure that you do your best. And if you are one of those people who gain a lot of fluid, or you know someone who gains a lot of fluid, make sure you tell them that they need to be careful with that, because that will lead to worsening heart disease. And for many patients, they're not able to be transplanted successfully because the heart has lost its pumpability. And no matter what kidney you put in place, you will not be able to deliver good oxygen if you don't have a good heart pump. So take care of your heart. Make sure you tell your loved ones, your friends, other people on dialysis, if they're gaining a lot of fluid, they got to make sure they can do their best to control that. So I thank you all so much. It's come to the end of this 30 minutes. Ask the doctor question, and even though there were very few of you, I appreciate you for being here. So thank you, Nancy. Thank you, Yolanda, and for all of you who are here. Thank you. Have a great year, and we look forward to seeing you again in 2025. God bless. Enjoy the time, and take care.